Nau mai, haere mai, ki koutou katoa. Welcome along to the first seminar of the 2025 series. It's a real pleasure to have you all along today. It's an important time for us all, reflecting on the loss of David Johnson. As many of you know, we're picking ourselves up and carrying on with the mahi that he was so passionate about. And so it's quite appropriate, I think, today that we're hearing from, I suppose, one of David's amazing proteges, Lauren Vinnell from from Massey University. Before I introduce Lauren, I just want to touch on a few of the protocols for the seminar today. So we'll just keep your mics muted right throughout the presentation. If at any stage you'd like to put a question in the chat, you're more than welcome to do that. And then at the end of the session, I'll open up for the Q&A, and any of those questions in the chat will be asked, and you can also just raise your hand if you want to ask a question at the end there as well. So Lauren is going to be talking to us about improving public behaviour during earthquake shaking, and this involves her incredible experience as an experimental psychologist looking at risk perception, also the practice of drills and the importance of drills for understanding what to do during an earthquake, and also touching on earthquake early warning as well to support that mahi. So really looking forward to hearing from Lauren today. I think there's a slide that I'll just touch on before Lauren begins her presentation, which is just to note that all of our seminars, they occur on the third Friday of each month. They also are captioned and put up on our YouTube channel. So if you want to stay in touch with those, just like or subscribe to the YouTube channel. And all of those seminars are always there. And there's more information about future seminars at the website there on the QR code. So thank you so much, Lauren. It's a real pleasure to have you with us today, and looking forward to hearing all about it.
Great. Thanks so much, Caroline. Really excited to be here. Apologies to those of you who've been to my talks before. Some of this is going to be a bit familiar, but there's at least something in there that is going to be new to everyone that I'm really excited to show you today. So as Caroline mentioned, if I can navigate through my slides. Okay. So I'm going to be speaking today about some of the ways we're exploring to improve people's actions during earthquake shaking. So as Caroline mentioned, I'm going to be starting with the role of risk perception, just sort of a quick summary of some of the challenges, because that could be an entire seminar on its own. And then some of the more sort of applied work we've been doing around practice drills and early warning. So this photo is from last year's annual ShakeOut drill in Gisborne, which was amazing to be part of. So I have actually been involved in QuakeCoRE since early 2017, so quite a while now. I started as a PhD student and then a postdoc, and now I am a senior lecturer supervising my own QuakeCoRE students, which is really cool to have been part of it for so long. It's been great. My work sits within disciplinary theme 4, so focused on particularly those social factors that contribute to people's earthquake resilience in New Zealand, but also through QuakeCoRE, I've had a lot of opportunities to work internationally as well. So today's talk has a few different parts. It's a little bit of a smorgasbord overview, I guess. I'm more than happy to follow up with anyone if there's a particular aspect you're interested in. But first off, I'm just going to very briefly explain why we care about what people do during earthquakes. This is probably pretty obvious, but it's always good to give the context. And then I'm going to go through some of the hurdles that we have to get over in order to improve people's behaviour. And the first one is getting people interested in earthquakes in the first place, especially before an earthquake happens, is a bit of a challenge. And then we need to help people learn what to do during an earthquake. And they need to practice what to do, and then we need to get them doing the right thing during actual earthquakes. And I'll just end today with one way that we're sort of looking to reduce earthquake injuries, tangentially related to this idea of teaching and practicing correct actions. So just to lay the groundwork, in case anyone isn't familiar, we get a lot of earthquakes in New Zealand, which means we get a lot of earthquake injuries. And looking at data like ACC injury reports, we can get an idea of how people are being injured during earthquakes. So a decent chunk of them are occurring because people are falling over or being thrown off their feet, which is why we recommend drop as part of drop, cover, and hold. We also see a meaningful proportion of people being injured when they're struck by flying objects or falling furniture, which is also why we encourage covering and holding, so protecting your head and neck. But we also see a lot of people being injured because they're taking the wrong action. So they're doing something deliberately in response to the earthquake shaking, but it's actually putting them at more risk, such as moving to doorways, we know is one of the absolutely worst things that you can do during an earthquake. Bit of a problem there in that we used to recommend it. So there's a bit of unpicking we have to do around that one. But the first hurdle we need to get across is getting people to care about earthquakes before they happen. It's really difficult to get people to think about something as big and scary as an earthquake when there are so many day-to-day challenges that people have to prioritize. And one of the assumptions around risk perception that we're trying to move away from is this idea that it's a linear relationship. So the more risk people perceive, the more likely they are to take action, which we know is simply not the case. We know that if people don't perceive enough risk, they're not going to care about it, which makes a lot of sense. They're not going to take action. But we also know that if we try to scare people too much, if people perceive too much risk, they're going to become what we call fatalistic. So they're going to have this sense of earthquakes are too big, they're too scary, they're too powerful, there's nothing we can do about them, so I'm not even going to bother trying. And the issue here is that sweet spot at the top of the curve where people are scared enough to be motivated to act, but not so scared that they disengage. It's really individual. It varies from person to person, and it's really difficult to target that effectively. So we have to try to find other ways around addressing people's risk perception of earthquakes. Another complexity is that we know the public tends to think about risk as this calculation of the likelihood of the event occurring and the consequences should that event occur. And there are lots of different factors which influence how people make that calculation. And we know that people tend to prioritize risks that are higher likelihood but lower consequence. So for example, something like a house fire versus something like a volcanic eruption. I know this is QuakeCoRE, but there wasn't an earthquake emoji, so I used a volcano, but they're pretty similar. And part of why this is because of what we call the availability heuristic. So people are more likely to prioritize acting on risks where they can easily recall an instance of it occurring, either to them or to someone else. And you're probably more likely to have either been affected by a house fire or know someone who has, rather than know someone who's been impacted by an earthquake. There are ways we can get around this. So the National Emergency Management Agency a few years ago did a Never Happens Happens campaign, which was great, reminding people that these events have occurred and can occur again in future. We also sometimes see that people sort of discount the severity, so maybe they don't believe that the consequences are going to be as bad as science tells us they are. So it's really important to communicate impacts of events as concretely as possible so that they're not abstract to people. It's easier for them to imagine those consequences impacting them, as long as you're not scaring them. So again, that's a bit of a tricky balance. But we also sometimes see likelihood discounting, which is one of the mechanisms that pushes people towards prioritizing these really high consequence, low likelihood risks, is when the consequence of the risk is, or the consequence of the hazard is so extreme, it doesn't matter how unlikely it is, people are not going to tolerate it. And it's really important when we see something like likelihood discounting that we address negative emotions such as dread, so that people are able to, really think about the likelihood component as well and not just focus in on those consequences. So there's more to it than that. I don't have a lot of time today. If you want to know more, get in touch. The risk perception is a really, really tricky business. It's important to consider, but there's a lot more going on in terms of people's actions during earthquakes. And another facet that we need to consider is multi-hazard context. So again, I know that this is QuakeCoRE, but we know that the public don't think about earthquakes in isolation. So it's really important for us to understand how Aotearoa's multi-hazard context affects people's risk perception. So these results are from an experimental survey I did a couple of years ago with my colleagues, Julie Becker and Emma Hudson-Doyle. And we just did a survey. We gave people some information about earthquakes and what they can do about them, then asked them risk perception questions, and then asked them about tsunami. And you can see that blue line, which is people's perception of earthquake consequences. It massively and significantly decreased if we'd asked them about tsunami beforehand. So this shows that people aren't particularly good at thinking about more than one of these big scary hazards at a time. If you've asked them about one, they may be likely to downplay the risk of the other as sort of a protective mechanism to stop them from feeling overwhelmed. We also see this in real life. So this graph on the right is from a study that we did 2023 in Auckland, looking at Aucklanders' perception of earthquake risk. Had the survey ready to go, launched it. The next day was the Auckland anniversary floods, which actually gave us a chance to do sort of a pseudo experiment. So we asked people how often they thought about earthquake risk, how likely they thought an earthquake would be, and how severe they thought the impact would be. And we also asked them if they'd been impacted by the flooding events. And we found that people who had been impacted by the flooding event thought about earthquakes less often, thought earthquakes were less likely, and thought the impacts would be less severe than people who hadn't been impacted by earthquakes. So if we're going into communities trying to encourage them to prepare for earthquake risks, it's really important to bear in mind their recent hazard experiences. So moving on now to behaviour during earthquakes. What do people say they do? So we have a lot of surveys asking people what actions they take during earthquakes. One thing that we see really often is people saying they, try to protect their children or dependents, which, makes sense. It's really understandable, but we know that's actually putting people at risk. As I mentioned earlier, we see a lot of people taking actions which they think are going to be self-protected, like running outside or standing in doorways. But we know in a New Zealand context, at least, they're probably not the best ways to keep yourself safe. But the majority say that they don't do anything. They wait to see if the earthquake is going to continue or get stronger before they take action, which is actually really problematic. Ideally, we want people reacting as soon as they feel the earthquake start, because it's really hard for people to know how big an earthquake is going to be while it's just getting going. They can ramp up. So as well as these surveys asking what people say they do, we have paired this with more objective data than surveys to try and get an idea of what people are doing during earthquakes. So we were able to get some video footage from Wellington Airport during the 2016 QuakeCoRE earthquake. Of the, I think, 68 people we could code, it was about midnight, so it wasn't very busy at the airport, but fortunately an international flight had just come in. We only saw one person fully doing drop, cover, and hold, which was pretty disappointing. We saw, about a quarter of people did something to try to protect themselves. Some tried to protect others, but the vast majority, they kind of just kept what they were doing. They kept standing, walked, looked around. They were clearly quite confused about what was going on and what they should do. But going back to that earlier point about the concern around people waiting to see if an earthquake would continue or get stronger, we were able to see, because of the earthquake characteristics, the arrival of the S wave really clearly in the videos. So there's a really clear point where the earthquake shaking increased in intensity. And 90% of the people who had what we called an uncontrolled response to that S wave shaking, so they were thrown around a bit, they weren't protecting themselves beforehand. So it's really important that we communicate to people that you need to drop, cover, and hold for weak shaking, because by the time the shaking is strong enough that you need it, it is too late. It's too late to do it, and it's too late for it to have benefit. So this is one of the challenges. Another complexity in terms of what people do during earthquakes is their social context. So whether they're around people or not, who those people are. So this is just a clip from one of the videos that we had, which is really interesting because we have these two groups in the same room. So we can be pretty confident they're experiencing the same thing, but they're separated by this divide. And you can see on the right-hand side, people are doing pretty well. They're crouching. The staff are sort of indicating to the public what to do, which is great. This left-hand side is really interesting. So you see two of the employees drop to the ground pretty quickly, which is great. One of them notices his colleagues running from the room and he gets up and follows them. So this is just sort of a little bit of an example of how it's really important, if you know the right thing to do during an earthquake, that you do it, because people who don't know what to do, they're going to look for those social cues. And if you're doing the right thing, you know, you may be able to protect someone else who's going to see what you're doing and copy you, hopefully. So we didn't quite see the behaviours that we would have liked to back in 2016. We have hope that things have improved since then, largely through this initiative called the ShakeOut earthquake drill, which is now run annually by the National Emergency Management Agency. So this started back in California in the US in 2008. The very first one run outside of the US was in 2009 on the west coast of New Zealand. Caroline was involved in that one if you want to hear more about it. It's really cool, really great initiative, really proud of that one. And then since 2012, we've been running them nationwide in New Zealand. In the last few years, we've been doing them annually based on some evaluation surveys we did, suggesting that yearly is appropriate for these. So for anyone who doesn't know about ShakeOut, at the same time, on the same day, everyone across the country practices the earthquake protective action, which in New Zealand is usually drop, cover and hold. We've had some years where I think we've topped 1 million people register for this. I think last year was maybe around 800,000, which is really, really cool. It's a really great initiative in terms of teaching people what they should do during earthquakes. And my team at the JCDR, we've done a few evaluations of the ShakeOut earthquake drill. We have some pre-test, post-test data from last year, which I'm still analysing, haven't quite got the results for you today, but they're on the way. But we do have evidence from an earlier evaluation that the ShakeOut drill is a really effective intervention for teaching people drop, cover and hold. So you can see those orange bars are people who participated in ShakeOut, the yellow bars are people who didn't. And you can see that people who participated in ShakeOut, they are much more likely to know the correct protective action to take inside. They are also much more likely to know the correct action to take outside, but we still only had 19% of people getting that right. So a bit of work to do there around people's understanding of what they should do if they're outside and feel an earthquake. But really encouragingly, we saw that 63% of people who participated in ShakeOut had actually used drop, cover and hold in previous earthquakes. So they were learning what to do and they were applying it, which is exactly what we want to see, compared to 20% of people who used drop, cover and hold in earthquake but not participated in ShakeOut. So really good evidence of the effectiveness of this drill in terms of getting people to do the right thing in an earthquake, with some, room for improvement, which we've been working on over the last few years. This is one of my absolute favourite collaborations. I love working with the NEMA team on the ShakeOut drill, partly because I get to go around the country and see some beautiful locations for the annual event. So we have an understanding of why people are getting injured in earthquakes. We have an understanding of what people are doing during earthquakes. And we have this great initiative to try to get people doing the right thing to keep themselves safe during earthquakes. And then in late 2021, along came earthquake early warning. So earthquake early warning is something that's existed in other places around the world for a couple of decades. The idea is it's not prediction, it's rapid detection, so people can be notified that shaking is incoming before the shaking reaches them. And there's been a lot of groundwork in New Zealand scoping out the feasibility of this, what we would need to have an effective system, including both the technological and the social aspects, because it's all well and good having a really great, efficient warning, but if people don't know what to do in response, it's not probably going to be all that helpful. Now, courtesy of the Android earthquake alert system, we have earthquake early warning for about 50% of people in Aotearoa if you have an Android smartphone. So we thought we would do a survey to see how people responded to this alert system, what they thought of it after an earthquake on the 12th of October afternoon, which is great. I think most people are awake, may have seen the alert, was really widely felt. So we had the survey running, we were collecting data, and then, as is often the case, we got another alert 10 days later, bigger, larger, felt by more people. And so we paused the first survey, made some tweaks, launched it again. But I'm going to be presenting results from both surveys today. So what did people do when they got this earthquake early warning, which most people didn't really know about, hadn't heard about before? We saw that, as we would expect from some of our sort of scoping research, one of the most common actions was mentally preparing. So about 20% of people saw the warning that earthquake was shaking and then kind of just psychologically braced themselves. We know that this is one of sort of the main perceived benefits of earthquake early warning, although as far as I'm aware, we don't actually have any evidence that the opportunity to psychologically brace limits psychological impacts. So it's something we need to explore. A lot of people kind of stopped and waited, looked for more information, or told others, which again is probably what we'd expect, but isn't necessarily going to be keeping people safer from the shaking. And we only saw about 5% of people using that warning as an opportunity to take protective action for the earthquake. And that may be because the earthquakes weren't particularly large. So the Android earthquake alert system has 2 tiers. It has a B alert and a take action alert. We haven't actually had the opportunity to do a survey of people who would have got that higher tier take action alert, which is the one that takes over your screen, screams at you. It's a really disconcerting noise, really noticeable, and tells you to drop, cover, and hold. So we may find that one is more effective at promoting protective action. But when we asked people who didn't do anything why they didn't do anything, a lot of them didn't understand the message or didn't know what to do. So this just shows that it's really important that if we do have a warning system, it's not just about getting the alert to people's phones, it's also doing the education beforehand to make sure that they know what it is and what they're supposed to do in response to it. And one of the interesting results from this research was that a lot of people didn't actually know that this earthquake early warning was coming from Google via the Android software. They thought it was coming from our national agencies, NEMA or GNS Science, which is probably an important misunderstanding to correct. So we're hoping to do a follow-up study to see how things have changed over the last few years. But we haven't had a convenient earthquake to do it because we want something big enough that a lot of people are going to feel it, not so big that we run into ethical implications of doing post-event research, but also during the day and with a wide alert diameter. We haven't had one of those yet. So stay tuned. Hopefully there will be a follow-up at some point. Not that we ever want to hope for earthquakes. So just a little bonus round because we did this a couple of weeks ago and I'm really excited to share it with you guys. Now, some of you may have met Eddie, our earthquake dummy for debris impact experiments. He's attended the QuakeCoRE conference. He's also been floating around the halls of the University of Auckland. He's still there, so if you see him, say hi. But the idea of Eddie is to, as I mentioned right at the start, try and find that sweet spot of making earthquake impacts concrete enough without scaring people. So we've seen from previous public education campaigns that using real people being injured by earthquakes or the threat of being injured by earthquakes, it prompts a bit of a shock response and people disengage. But we also think that not having anything in the footage and just, showing houses being destroyed is probably going to make it too hard for people to make those, impacts concrete, imagine themselves in that situation. So we found this compromise where we have Eddie, who is a training dummy. So he's the size and weight of an average adult male. And we put him on the shake table at the University of Auckland Structures Testing Lab. And hopefully these videos play. So in the first one, we have the bookshelf restrained, just a couple of cheap brackets. So that is a simulation of the shaking from the Christchurch earthquake. You can see it doesn't look like fun. He'd maybe have a few injuries, but he would probably be able to get up and walk away. And then we removed the brackets on the bookshelf, did the same shaking, and this is what we saw. So quite a big difference in terms of Eddie's experience between those two videos. So what we're going to do now is we're going to do a hopefully longitudinal behavior change experiment where we're going to make a clip of these because we have 4 cameras, slow-mo and everything. It looks amazing. We're going to make these little clips. We're going to show them to people as if it was a public education campaign and show some other people traditional public education material, and then see if these Eddie videos are effective at encouraging people to take basic mitigation actions around their home, like strengthening bookshelves. The idea is that it's easy enough for people to imagine themselves in Eddie's situation, but he's very clearly not an actual person, so it's hopefully not going to be too shocking for people that they disengage. So stay tuned for that one. That's going to be one of my big DT4 projects this year that I'm really excited about. Yeah, so as Caroline mentioned at the start, unfortunately at the start of this year, we did lose DJ, who was one of the masterminds, forces of nature behind DT4, amongst many other things. So a lot of the research I've spoken about today, he was involved in. But you know, the work is not going to stop. We're gonna keep going. We're gonna stick with the mission and keep trying to keep Kiwi safe from earthquakes. So if you're interested in reading or hearing more about anything I've spoken about today, a lot of it is published or in the works. Or as I said, if there's anything in particular you're really interested in, I'm always happy for you to drop me an email and we can talk more. But that is me. Thank you everyone for your attention.